All right, you guys ready? All right, good morning, everyone. Listen, it's wonderful to be here with the home team in Philipstown, thank you, that I call home, and so proud to do so, and so proud of my friends, and we are friends and partners in local government, and we work so closely together on so many things. I'm always excited when we can celebrate local successes, not just here, everywhere, but it's obviously meaningful here where I live. And I have to tell you, I'm so proud of Philipstown, in particular Putnam County as well, which has now one of the highest vaccination rates in the state of New York. So there's real success that's been achieved here. Over 80%, I believe, in the town of Philipstown of adults have been vaccinated with at least one shot. Basically 70%, I think it's 69 point something in the county, which is fantastic. I think making Putnam County ranks 2 out of 62 counties in the state of New York. So that's awesome. So give yourselves a round of applause. That's fantastic. And that is why we're seeing the positivity rate in Putnam County now below 1%. And that's fantastic, because we know in the third wave, we saw positivity rates get up to close to double digits again, right? It was 8-9% for a while, which was frightening for all of us who had lived through that, saw it come down, and watched it go back up. So we know that this virus is a formidable enemy. This is a formidable enemy, this coronavirus, but we are winning this war. And what we're trying to tell people today is we don't want to snatch defeat from the jaws of victory. We know that there is vaccine hesitancy now among the population that has yet to be vaccinated. We know people have questions. We're not trying to say people can't have questions. We understand people have concerns, and that's fine, and that's normal. What we do want people to know is that we strongly believe that if you ask those questions, you will get good answers. You will get answers that encourage you and your family to get vaccinated, because it can still save your life. It can save a loved one's life. And this is a game where everyone has to participate. And so while we have made so much progress and we are at a level of vaccination that is still very exciting, there are still some troubling things that we know are going on out there. We know that the virus is still at horrific and alarming rates around the world. We know that that level of infection in these countries can produce the development of variants that people don't understand, that develop in the human body. And so the more people that are carrying the coronavirus, the more variants we will see. And the concern is that these variants can be more lethal and more contagious. And if they're both, or worst case scenario, if they are resistant to the vaccines we've developed, then we could be in a very different situation with this virus, even though we seem to be coming to the end. And we know we're going to have a challenge in the fall anyway. What we don't want to do is have a population that isn't sufficiently vaccinated go into the fall, be dealing with a more virulent strain of the virus, and be unprepared for it, and be right back into the type of situation we all lived through and never want to repeat. So I really want to thank my friends who are here. I'm here with Philipstown Supervisor Richard Shea, with Putnam County Legislator Nancy Montgomery, with Cold Spring Trustee Kathleen Foley, Philipstown Town Board members John Van Tassel and Judy Farrell, and Mark Snyder from Drug World, who has been spearheading the efforts to vaccinate folks in this part of the world. He knows this, but I have a spy in this operation, which is my husband, Randy, has been volunteering now for, I think, 4 or 5 months, vaccinating people, and I get a daily report. And what Randy has told me, and it's true, but you guys can speak to it as well, is that the first dose numbers have gone way down, even as the second dose numbers went way up, right? Because we have so many people still getting the second dose, but we do see a decline, a meaningful decline in those first doses. And that's partly to be expected, but it is an alarming trend that we want to work against. We want the remaining people out there who have not been vaccinated to feel comfortable. Today at this location, you can walk in from 1:30 to 4:30, I believe.
2:30 to 4:30.
Exactly. Well, like I said, 2:30 to 4:30. It is today.
We're just doing single shot Johnson & Johnson.
Single shot Johnson & Johnson, though one and done, so you can come here.
And then we're doing second shot Pfizer.
Second shot Pfizer, same hours.
Same hours, yeah.
Right, so if you get your second shot of Pfizer, but presumably you would have been here before, but you can show up today without an appointment. Between 2:30 and 4:30.
I do recommend registering ahead of time to save time, but you can just show up.
Right. So, like I said, we recommend registering ahead of time, but you can just show up because we're Facebook Live, right? So for those of you who may be watching right now, we're here in Garrison. You can come down here if you can register online. Is that the deal? How do you
Putnam
register?
County Department of Health.
Putnam County Department of Health. You can register online, but if you want to show up, you can just show up. Point is we want folks who may be looking for a simple way to get vaccinated. You can get the Johnson & Johnson shot, and you'll be done, and it will be highly effective, and you will be in and out of here in just a few minutes. And so I'm going to let Nancy Montgomery take the podium, and some of my other friends here who've been leading these efforts, because they can speak to it with more knowledge than I can. But I want to thank them for what they're doing, congratulate them on the success we've had, and for those of you in the press, you'll know that this is the third or fourth county that we visited on this vaccine hesitancy tour. We've been in Dutchess and Orange, and we did Westchester early on. The point is that we really want to get the word out that this is not a situation where a few people are going to do a lot and it's going to be okay. This is a situation where a lot of people are going to do a little thing to get us out of this problem. So everyone's got to play a role. And if you've got questions, please ask them. Go online. There are reliable sources, and you can get those questions answered. But at the end of the day, we think it's going to point you towards good health and a good decision of getting vaccinated. So Nancy Montgomery, why don't you come up and say a few words, and thank you for what you're doing.
Thank you, Congressman Maloney. I don't have much prepared, but as the Congressman said, if you have questions, just ask. The point of this is to get people vaccinated. We're trying to, solve this problem of people being hesitant and getting the vaccination. We've had so many great responses to the offerings here in Philipstown between Drug World and all their hard work, our pharmacy. And, it's interesting that our recreation director, Amber Stickle, is here as the expert and, giving us the information. They have just bent over backwards at the rec department here and opened their doors to get our citizens and now the far reaches of Putnam County and the region vaccinated. We've had great partners in this in getting people vaccinated between the schools, our businesses, our not-for-profit organizations. We don't need to hesitate to get vaccinated. If you have questions, find somebody. I'll answer your questions. Nancy.Montgomery at PutnamCountyNewYork.com. You can call our office. Your employers will help you out. I've been going around to local businesses and trying to get our immigrant populations vaccinated. They don't need to be afraid. You just need to come out, ask questions, get vaccinated. We're here to just fight this pandemic. I had a reporter ask me once recently, do I think it's a political thing, R versus D, the reason why Philipstown has such a high vaccination rate, and I will not even address that. It's not about this. We're all partners, and we're all in this together, and we can get the entire country vaccinated. So let's just come on out and do it. Encourage your friends and neighbors to do so. We'll see you today down here at the rec department.
Yeah. That's a great point that Nancy makes. Listen, we're going to go back to fighting about everything as Democrats and Republicans, right? Like, we reserve the right to continue to fight about everything. But people who disagree about everything should agree on this. This is about public health, not about politics. And I have to say that I want to thank the County Executive, Marilyn Odell, who did issue a statement in support of our efforts that we're including with our press materials today, which I think is evidence that we can work together on some things. But Richard Shea, why don't you come and join us? Richard, who is, I believe, in his 8th term as, is that right?
Yes.
Town supervisor. People ask me about term limits, man. No, he's in his.
I support them.
After 8, I'll be ready too. This is one of my best friends in politics, who I think is so great. We're doing a bunch of stuff with Philipstown together.
Yes.
Say a few words, Richard. Thank you for all you're doing.
Thank you, Congressman Maloney. The one thing I would say is, the Congressman alluded to the special relationship that he has with this town. I've never seen an elected official so concerned about his constituents, not only in this town, but throughout the entire Hudson Valley, and making a priority everyone's safety here. So we really, really appreciate that. Thank you. Making sure that we got all the doses that we needed here in the Hudson Valley, and again, prioritizing public health. As Nancy alluded to also, there have been so many relationships formed during this, and a lot of people look at government and say all they see is dysfunction. But when you look at this crisis, you realize you need good government, you need good governance, and you need good representatives in Washington, like the Congressman, like Nancy Montgomery at the county, and like the Philipstown Town Board, to work together. And I say our partnership with Putnam County this time is a stellar example of that. We all pulled together to make sure this site got up and running, and it was support. It was all hands on deck. There was no politics whatsoever involved in this issue. So that was really important. And people need to look to government to solve big problems like this. When you're talking about a public health pandemic, climate crisis, these are issues that are not going to be solved unless we can get together and work together on them. And I know our congressman is working on all these issues. And the town board here, I can't say enough about all our board members. One person who didn't get mentioned, Councilman Flaherty here. I mean, it's great. I have the greatest board in the state. I'm telling you right now, they make my life so easy. And it's been great to have all these partnerships with Drug World and Mark. I mean, the help that everyone pitched in is the reason that we have such a high vaccination rate here in the town. So I can't say enough about government at this time and about our congressman. So thank you.
Hey, thank you, man. Thank you, Richard Shea. Thanks for all you do, and congratulations on that snazzy new building you guys restored. It looks beautiful. I run by it almost every day. And no, I'm kidding aside. It looks wonderful, and I'm so proud of you guys for having the wisdom to invest in the beauty that you already had. I know it must have been a complicated project. I really want to thank Mark Snyder, who's here, and invite him to the podium. He and his mom have been spearheading this through Drug World. Come on up, Mark, and talk about what you guys have achieved. It's pretty exciting from where you started to where we find ourselves. Go ahead.
Thank you very much. Since the beginning in January when we were going to receive vaccine, one thing I want to mention with the volunteers that Drug World and St. Mary's has been able to pull together, and your volunteers here that have done an amazing job getting people in and out. This community in Philipstown has all pitched in. Retired nurses, active nurses, people that on their days off come in, people that have worked a 12-hour shift and then come to our clinics to vaccinate the community. Those are the people that we really have to thank who pitched in to help us put on these clinics. Drug World has done a little over 5,000 vaccines since January as a small, tiny independent store, which has been so great. I mean, it is the meaning of a community pharmacy is what we are. And it's been so fulfilling as a business owner to actually have the ability to have this effect on our community. If you're unable to make it today to the rec center, you can, and if your schedule allows it, Monday through Saturday, you can walk into Drug World at any point and get any 3 of the vaccines starting tomorrow with the Pfizer. But we have Moderna.
Age 12 and up now?
Pfizer is age 12 and up. But starting tomorrow, we'll have Pfizer, but we have J&J and Moderna. You can walk in any day, anytime, between 10 a.m. and 6 p.m., Monday through Saturday. And we're trying to make it easier based on the schedules. People that are afraid to get their vaccines now, maybe it just has to be on their schedule, not on our schedule. We would always do clinics, and now we have to be on their schedule. And they have the free time, and pops in their mind, let's go get vaccinated now. Stop into our store and we can do it right then and there.
Man, that's great. Thank you, Mark.
Thank you.
Thank you very much. And isn't that amazing? I mean, that is one small town pharmacy that has done 5% of the county. I mean, you've done 5% of the vaccinations in Putnam County. That's pretty amazing. And so if you were waiting because you thought it wasn't available or you've been hearing about these shortages, that is long past. We have plenty of vaccine for everybody. It's really easy to get an appointment. You don't even need an appointment in most cases. So if you have questions, talk to your neighbor, talk to the coach on your kid's sports team, talk to your pastor or your priest, someone you trust, because we think the answers will be the right ones. Any questions? You, Ben.
What are some of the unique ways that you are trying to address it here in the county? Online, door-to-door, transportation, anything like that?
Right. I think there's a variety of incentive programs that the state has been trying to put in place. If there's anything on the local level, you guys should come up and speak to it. Come on. But I'm for whatever works.
Yeah, I mean, there's been so many innovative ways to get people vaccinated, and just on a local level. I work at a local restaurant, so it's, going into local restaurants even and finding, the employees who aren't vaccinated yet, or some from the immigrant population who are afraid to get vaccinated because they're not sure, what will happen. Do they need documentation and things like that? We were working on with Trustee Foley and the school districts in getting, Spanish-speaking messages out. We're still working on that, and we want to do it before school ends, getting messages out to different groups and populations to make sure that, just to get rid of the fear of getting the vaccination, or making sure that they're aware that it's accessible anywhere you go. And now with the drug world news that you can walk in and get it, that's wonderful.
And it's free, right? This does not cost you any
free.
money. It is 100%
Insurance,
free.
no insurance.
No insurance, with insurance. And I think the point Nancy makes is great. I think sometimes who maybe are on the conservative side of the immigration debate and who think we shouldn't be doing things for people who are undocumented, this is the exception. This is something you really do want to do for every human being. One, because people should be treated with dignity and respect, but even if you're the most conservative person on immigration, the fact is that you want every person in your community, in your county, in your society vaccinated, because it's public health and the virus doesn't care whether people are documented or not, and it can spread. So we need every person, without stigma, without fear, without cost, without barrier, to get a vaccination. Anything else, man?
So, does politics have anything to do with vaccine hesitancy?
Look, we know that politics has infected every area of our country right now. So the honest answer is, of course, there's politics floating around. But I think that responsible adults need to really step up and say that this is an area where the politics should be left at the door. And regardless of how you voted in the last presidential election, regardless of what your ideology is, regardless of what your position is on almost any issue out there, this is an area where we should set politics aside, because it's for the good of all of us. And there'll be plenty of credit to go around when it goes well, and we'll all benefit when the economy comes roaring back and we can live our lives the way we are. The only reason we're out here without masks right now is because of the success we've had to date. And so I sure hope we can get the politics out of it. But of course there are a variation in rates, we know, based on the politics of the communities that you're talking about. And that's a shame, because I think that all of us have a responsibility to get out the science and the facts. And that's why I say, if you have questions or you've heard things that concern you, we're not saying you can't be concerned. We're not saying you can't ask good questions. It's a normal thing to ask, is the vaccine safe? It's a normal thing to ask, what about my child? It's a normal thing to say, hey, I might be having a baby. What does it mean for pregnant women? These are all concerns people express. But there's great answers for that, and they're based in science. And by the way, there's a couple 100 million Americans who have had a first shot now. And so we have a massive amount of data on the safety and efficacy of these vaccines, and it's all very good news. So there'll be time for politics when the pandemic is over. Trust me. All right, thank you all very much. Thank you to my friends, and get vaccinated.
Yeah.